Good day everyone, I am Kazana Kulay of OLFU from BSN 117A. Today, I will be demonstrating the procedure for transferring a patient from bed to chair to ensure safety and comfort throughout the transfer. First, check the patient chart and care plan. Look for anything that might affect how the patient can move, like IV tubes, wounds, or movement limits. Use the guide if available to plan the safest way to move them. Second, wash your hands and wear PPE to prevent infection. Third, identify the patient and explain the procedure. Good day, sir. I am Curlay, your nurse for today. May I know your name and birthday?
Dominic Anson.
May I check your wristband? Okay. I will be helping you to move from the bed to chair. You may feel a bit of pressure, but it'll make you comfortable at the end. Is that okay? Fourth, move equipment if needed to make space for the chair. Next, close the curtains for privacy. Since we are in a private room, assume that all of the curtains are already closed. 6. Lower the bed to the lowest level. Raise the head of the bed so the patient is sitting up as much as they can handle. 7. Lock the bed wheels. Place the chair beside the bed. Then lock the chair wheels, or if it doesn't have any, make sure it's braced against a wall. Next, let the patient use a stand assist device if available to have them move toward the edge of the bed and lie on the side of facing the chair. 9. Lower the side rail if needed. Stand near the patient hip with feet apart but slightly forward. And then 10. Help the patient sit up. Ask them to swing their legs over the side of the bed. While doing this, support their back and shoulders. Swing po your 11. Stand in front of the patient. Ask them if they feel dizzy, then let their leg dangle for a few minutes. Sir, do you feel dizzy? Okay. Number 12. Help the patient put on robe and non-slip slippers. Next, put on a gait belt around their waist. 14. Ask the patient to slide his buttocks on the edge of the bed until the feet touch the floor. Stand close and place your foot outside theirs. If someone is helping you, have them do the same. Next, 15. Encourage use of stand assist. If someone is helping, have them hold the belt. Count to 3 and have the patient stand up using your legs. If they have a weak leg, support it with your knee. Check if they feel steady. Yes, sir, now we will complete off po. On the count of 3, 1, 2, 3. Sir, do you feel dizzy? 16. Turn the patient slowly until the back of their leg touch the chair. Slowly po, slowly. Do you feel the back of the chair now? Okay. 17. Ask the patient to sit slowly. Support their knees with yours and hold the gait belt. Bend your hips and knees to help them lower. Okay, 1, 2, 3, slower, slower. Okay. 18. Check the patient if sitting properly. Remove the gait belt, cover them with a blanket, and place the call bell and important items within reach. Lastly, clean equipment if needed. Remove PPE and perform hand hygiene. day everyone, I'm Cassandra Colay Palacio Pangilinan of OLFU from BSN1 M7A. Today I will be demonstrating the procedure of transferring a patient from chair to bed to ensure safety and comfort throughout the transfer. First, check the patient chart and care plan. Look for anything that might affect how the patient can move, like IV tubes, wounds, or movement limits. Use a guide if available to plan the safest way to move them. Second, wash your hands and wear PPE to prevent infection. Third, identify the patient and explain the procedure. Sir, may I know your name? When is your birthday po? Can I see your wristband? Okay. Sir, I will explain the procedure to you. I will be helping you from moving a chair to bed. Please tell me right away if you feel uncomfortable. Okay. Step number 4, move the equipment if needed to make space for the bed. And then, 5, close the curtains for privacy. Since we are in a private room, I already closed the door for the privacy. 6, lower the bed to the lowest level. And 7, lock the bed wheels. Next, help the patient to scoot forward the chair until their feet reach the foot. Okay. And then 9, wrap the gait belt around the patient's waist as per hospital protocol. Sir, I will wrap this gait belt for you. Next one po, wrap the gait belt around the patient face as the hospital protocol. 10. Ask the patient if they feel dizzy or weak before standing. Sir, do you feel dizzy? Okay. 11. Stand in front of the patient with feet shoulder width apart and knees slightly bent. 12. Assist the patient to stand. Use the gait belt and count to 3. Help them raise using your leg. I will now raise you po. On the count of 3. 1, 2, 3. Number 13. Turn slowly with the patient until the back of their leg touch the belt. 14. Ask the patient to reach back and feel the bed. Do you feel the bed? Okay. 15. Support the patient knees with your knees. Gently lower them to sit. Bend your hips and knees as you assist. Okay, 1, 2, 3. Next. 16. Assist the patient to lie back in bed. Ask them to swing their legs up to the bed while you support their trunk and shoulder. Number 17. Help the patient move to a comfortable position in bed, ensuring their body is aligned properly. 18. Cover the patient with blanket. And 19. Remove the gait belt. Clean and store the dispose of used equipment properly. 21. Remove gloves if used and perform hand hygiene. That's all for transferring a patient from bed to chair and transferring patient from chair to bed.